Nurses are the front line of patient care, which means that they are the first to notice when a patient requires something, whether it's a life-saving medication or just human compassion. But every scenario is a complex tangle of healthcare considerations, which only strong critical thinking skills can unpick. And this is exactly why the NCLEX leans so heavily on assessing a nurse's critical thinking and reasoning skills. And this aspect of the exam is also the most difficult to prepare for. Well, here to help us with some sterling advice on developing your critical thinking skills is Damion Jenkins, a registered nurse with a Master's of Science degree in nursing. As the founder of the Nurse Speak YouTube channel and brand, Damion has bent his formidable education and experience towards the realm of NCLEX prep, and he's become quite the expert in the critical thinking space. So with that said, here's how the NCLEX challenges critical thinking and what you can do to prepare. Okay, so Damion, let's get a little sciencey here. What is critical thinking?
So critical thinking has been defined in a variety of ways, but the way that I like to define it is making careful and systematic decisions about the data or situation that you're faced with, having to deal with. And, critical thinking in nursing and on the NCLEX per se is really about applying all of the knowledge that you've learned in nursing school and analyzing data and then thinking about the rules, principles, and guidelines that govern that decision making. It's not just one simple formula. There's a lot of different considerations that go into critical thinking. But to help people out on the NCLEX, critical thinking really can be found within the nursing process, following those steps one by one, and then you'll find yourself carefully looking at all of your options before you make a decision about what to do next.
Right. Okay, so you've touched on how nurses are expected to apply their critical thinking skills, but can you give me an example in a clinical setting of how a nurse might do that?
Sure. I mean, there's so many moving parts in nursing, and this is the whole point of the NCLEX, really to get an idea of how people entering into practice are going to be when faced with different situations. Can they think carefully? Do they understand the rules that guide decision making? Can they remain objective? Yeah. That's really key. High stakes, lots of subjectivity, lots of emotions going. Yeah. So really, clinical settings, they expect us to be able to operate in a very systematic approach. And so this is why we learn the nursing process. And so a lot of examples, let's say that you have a patient who is in a lot of pain, their vital signs are abnormal. You have a physician who is upset because you're not moving as fast as maybe they would like you to. You have a family member that's asking you for everything under the sun. And you have to, in that moment, in that snapshot in time, make a decision about what should you do first. Mm-hmm. Should you manage the patient's pain? Should you address the physician's issues? Should you speak with the family member? What's going on? And so using critical thinking and following the rules that guide decision making, like the rules of prioritization, for instance, you can then say, okay, well, based on all of this information, all of this data that I'm assessing, which one's most important? And if we follow the fundamental rules that guide decision making and default to, say, like Maslow's hierarchy of needs, for instance, we have to manage that patient first before anything else. And so using these tools for critical thinking can help you arrive to the answer in a much more concise way.
Right. And so then how does the NCLEX really dig down, drill down and test people's critical thinking skills?
Yeah, so they do it at 4 different levels, really. There's 4 different levels of questions: recognition, recall, comprehension, application, and analysis. Well, the application and analysis level questions, the higher level questions, this is where they really challenge critical thinking. Not only do they expect for you to be able to recall your nursing content that you've learned, but also apply it and then interpret data to make careful decisions about what to do next. And so they challenge a variety of concepts that we learn in nursing school about prioritization, delegation, scope of practice, legal and ethical responsibilities, all of these concepts that don't necessarily have an exact way that plays out for every patient, but depending on what's going on, you still have to follow those fundamental rules. Sometimes we skip a few steps to get to the right answer, depending on what's going on. But on the NCLEX, they expect for you to always follow those rules, because there's no other way that they can test your ability to be safe, right?
Yeah.
Safety is just so broad. There's so many things to consider for safety. We can't just simply create safety questions. We have to create questions that challenge individuals' understanding of the concepts. So
Right.
then we can determine, can they make safe decisions based on their understanding of those concepts?
Okay, so then what would be the best way for nurse students to practice and hone these kinds of skills?
So really the best place to start is to make sure that they truly understand the rules, principles, and guidelines and nursing concepts that guide decision making. Now, as an experienced nurse educator and someone that I've been helping individuals pass NCLEX for years, I know it to be true that nursing school sometimes misses the opportunity to really hone in on that content. As an educator, I know we have a tremendous amount of information to cover in a very short period of time, 2 years typically for the average nursing program.
Yeah.
So if we don't optimize our opportunities, or, really grab onto those experiences where we can emphasize that critical thinking and the concepts that guide decision making in skills lab and clinical and in the classroom, then a lot of people leave nursing school not really knowing how to apply that information. So I would start there. There's many NCLEX resources, as you know, that cover a lot of these concepts, but I focus specifically on filling in the gaps that I've identified over the years. Yeah. So really starting there with your understanding. Mm-hmm. Then once you have that foundation understanding, then it's about that repetition, that applying it to the content. How do you recall this information? How do you file it away in your brain so that you can pull it out and use it when you need to use it? And that goes into being able to identify what the questions are asking and how the questions are challenging your understanding on those concepts. And there's many ways that you could do that when you learn how to go through that process of figuring out what the question's asking.
Right. And I think it's sort of, we need to emphasize the importance of, as you said, repetition and practice.
Absolutely.
With skills like playing piano, learning a language, and critical thinking, it's all about practice. Yeah.
Correct.
Okay, so when it comes to NCLEX prep, one of the main themes of advice out there is to study both the content and practice your critical thinking skills. So in your opinion, how should nurse graduates allocate their time between the two?
Yeah, that's a very delicate balance. And this is why, my NCLEX service, kind of sets apart from others, is because I have an opportunity to connect with individuals and figure out where are their strengths, where are their weaknesses, do kind of an assessment on where they are with their ability, give that foundation information, and then pull. However, if I don't have an opportunity to connect with anyone like that, I recommend that you at least, at a minimum, go over the NCSBN test plan, which is free for everyone. Yeah. I can't emphasize this enough. I get so disheartened to find out that, clients, students, people trying to take the NCLEX have never even seen the NCSBN test plan. Mm-hmm. They've never been directed to it by their professors, which I don't understand why they wouldn't do that. But start there and then challenge your understanding of the content. Can you speak to it in the way that a nurse should? Mm-hmm. Once you go through that process, then review the rules, principles, and guidelines that guide decision-making. All of the NCLEX resources, for the most part, cover them in a general way. The rules of prioritization, delegation, therapeutic communication, those types of things. And then with that brief review, which could take up to a week, depending on your schedule. If you have lots of obligations, it might take a few weeks to get you ready for that part. Then you can start doing practice questions in whichever resource you're using. So then you can challenge your ability to identify these things. How can you make decisions about the answers rather than just picking the answer that you remember to be true or that you think sounds right, actually applying what you learned to validate that those answers are correct, the same way that nurses are expected to validate our assessment findings.
Yeah. Okay. So then at what point in their NCLEX prep should a student really start focusing on and practicing and honing these skills? Like right from the start?
Away.
Oh, right. Okay.
Right away. Absolutely.
Yeah.
Right away, because if you wait until the end to start understanding how NCLEX style questions are formulated, how are they challenging your understanding of the rules and guidelines, then you're going to be like many of us, where you get through your nursing program and now you feel like you're starting all over because you never had the opportunity. So I really recommend that nursing students start from fundamentals, from the very first semester. And yes, the very first semester is a shocker for all of us. It's reality shock. We're like, what's going on here? But the sooner you start to get that inside scoop from an educator's perspective and from the people who research NCLEX, people who design NCLEX questions, then you can start to get kind of an insider's view on how it is you're going to be challenged. It's just like when you want to succeed in a class, you want to know what the expectations are. You want to know what your learning objectives are. Well, starting sooner than later with figuring out what is the expectations of the NCLEX would benefit everyone.
Exactly. Yeah, that's great advice. Okay, so your brand, The Nurse Speak, helps students and graduates prepare to take on the NCLEX. But first of all, tell me, how did you become such a sharp situational analyst and critical thinker?
Yeah, so, some people have a natural knack for critical thinking, call them inquisitive. My mother would agree that I probably drove her crazy growing up about asking why. All kids go through that phase. Why? But I always was like that, and I continued that process because I was never one to just fall in line. When someone says, do this, I want to know the outcome. I want to know what's the anticipated goal. I want to know what are the steps in order for me to achieve that outcome. And then how do I know if what I did is actually meeting the expectations? And so really, this is the same thing for the nursing process. It's the same thing for when we're creating a care plan for a patient and we're setting goals. And then how are we measuring that we've met those goals? It's the same thing. Wow. So going into the NCLEX, I was pretty confident that I could figure out what the questions were asking. But did that mean I left nursing school and I knew exactly how to use all the information I learned? No, I did have to take about a month or two of self-preparation. I did use some NCLEX resources to help me, but it was pretty easy for me to figure that out. It's not always that easy for everyone else. And then just over the years, working as an educator and creating curriculum and then seeing the gaps and how we could have an opportunity to increase or improve the way that we are translating the information. That's the big key, is that communication piece. How are we creating learning activities that are going to help students retain this information and be able to pull on it when they need to? And then it really comes down to just years of practice. It's the same thing. I became as good as I am because of practice, because I did my research, because I challenged NCLEX style questions, because I attend the NCSBN conferences and webinars to learn about the changes coming to the NCLEX. I'm able to speak from, a point of being informed and being able to speak to what the expectations are. So
it starts with a curious, inquisitive mind.
Absolutely, and that continuous practice.
Yes, and the practice, yeah. Okay, so tell me, how do you actually help nurses develop their critical thinking skills?
Yeah, so what I've done is I've developed a program that, again, lays down the foundational information, because I believe strongly as an educator that you need that foundation information. I give individuals an opportunity to fill in any knowledge gaps that they may have, so that we don't have to spend too much time in content, because that is a killer for a lot of people. It's a time waster. You spend copious amounts of time consuming content, but if you don't know what to do with that content, and if you don't know how you should focus that content, well, you'll never stop learning. You'll never be ready at that point, right? So what I do is I give them an opportunity to kind of get an idea of where they are with content. And if they're struggling too much with content, then give them very specific instructions and focus items. And then from there, I then start reinforcing the rules, principles, guidelines that drive decision making. I break down those NCLEX questions and show them the anatomy of the NCLEX questions and how you can pull out pieces to start making decisions about how you need to answer them. And then I give them lots of opportunity for practice with that ongoing feedback. And that's really how I help them to get past any barriers they may have. Are they second guessing themselves? Are they changing their answers? Are they deviating from the process? Just like as the nurse, we can't deviate from the process. We always should assess if we don't know what's going on, right? And when you follow those rules and stick to it, you're a lot less likely to make a mistake and much more capable to validate your answers and then feel good that you selected the best option because the rest of them didn't meet the criteria of the process.
Yeah.
And so it's just really about repetition and that practice, sending them to a variety of resources. I don't create every single piece of information that my clients consume. I didn't create the NCSBN test plan, and there's a lot of other really great free resources out there that I will have my clients go to if I feel they need a little bit more time with content.
Yeah. Oh, that's great. Well, Damion, thank you so much for chatting to me today. I think we've got some excellent advice for nurse students. So
awesome. Thank you so much.
Great. Well, there you have it, the best advice on why critical thinking skills are so important and how you can best hone them ahead of the NCLEX, courtesy of Nurse Damion Jenkins, founder of The Nurse Speak. Well, if you feel you could use more guidance on preparing for the NCLEX, you can get in touch with Damion via his website, thenursepeak.com, or on Facebook, Instagram, Twitter, and LinkedIn. Details below. If you are studying to become a registered nurse or nurse practitioner, make sure you get Brainscape's NCLEX or nursing flashcards, which will help you study so much more efficiently and keep up that healthy cadence of daily review that is so essential for doing well in these content-heavy subjects. For even more guidance, check out the other videos we have on Brainscape's nursing channel and go to the Academy for A to Z study guides on how to excel in nursing school and beyond. These tools, together with your ambition and hard work, is everything you need to rise to your challenge.